Well, now we can speak to Dr. Jennifer Wild. She is a consultant clinical psychologist at King's College in London, and obviously concentrating on, as we've done a lot, of course, the mental state of those miners underground, but we know more and more about them. Just sketch in for us what their condition is.
The most part, they're focusing on getting out and being on top and rescued, which is very good because that will keep their psychological ill health to a minimum. Those miners who still fear that they may not get out or are very worried about not seeing their families again and dying are more at risk of developing post-traumatic stress disorder. There still is the getting into the rescue capsule and getting up on top, so that may be another situation where they're going to be focusing on anxiety. So it will be really important to keep them focused on the fact that they're getting closer and closer and closer to the surface and that they will be on top and safe.
So what you're saying is those of an optimistic turn of mind, if you'd like to put it that way, are likely to be find it easier once they get to the surface. Pessimists might suffer in the longer term.
Well, I think the miners have been told to focus on the fact that it's a temporary situation, and I think that's really helping. But that may be difficult when they're in the rescue capsule and their heart rate is beating really quickly. They may tend to focus on their anxiety symptoms, and that's going to make it more difficult. Once they're on top, there may be a range of symptoms they may develop which would be normal in the first month after trauma, such as having unwanted memories of being underground, being uncomfortable in dark or enclosed spaces like a bathroom. But if that continues for more than a month, then that's more problematic. It means they're at risk of developing post-traumatic stress, which could impact their relationships with their family, their ability to work, that sort of thing.
And there's a young one there, well, youngish, isn't 19 years old, sounds to have been having a particularly difficult time. What do you put that down to? Is it just his age, do you think? PTSD can strike at any age. Post-traumatic stress can strike at any age. It's not his age. It could be his level of experience, and it could be really what goes through his mind on a day-to-day basis, he could really believe he's not going to get out, which makes him more vulnerable to developing anxiety problems when he does get out. What do you think about those men when they do get them out, and let's hope it all goes swimmingly well? What do you think about them actually going back down the mine?
I think that will have to be their choice. So what I would be worried about is if they didn't want to go back into the mine because they were scared to do so. I completely understand, we all understand they won't want to go back into a mine, but if it's, I don't want to go back into a mine because I just don't want to, that's a sign of recovery. If it's, I don't want to go back into a mine because I'm terrified it's going to collapse, that's a sign of anxiety and potentially that they'll need some sort of intervention. The best treatment for post-traumatic stress is cognitive behavioral therapy, and that would really potentially take the miners back to a place where they may need to go underground very briefly, just to get them familiar with that situation and to reduce their beliefs that it's dangerous and reduce their anxiety symptoms. So if they can do that, not necessarily a real mine, but something, that would be very, very helpful for them. But if they're choosing not to go underground because they're absolutely terrified, that means it's still having an impact on them.
What would your advice be? If one of them was sitting there, but they've got to make a living, haven't they? No doubt there'll be, you know, books and TV and even films and carrying them along for a while. But in the end, they've got to make a living in a part of the world where jobs are not plentiful. So they may have to go down, some of them at least. Yeah,
so they may have to go down, and I think they're going to have to feel very confident in the health and safety standards of the mines underground, and that's going to be very beneficial. Not all of them are going to develop these post-traumatic stress symptoms. Many of them probably won't, but those who do will need to have intervention, and some of them will absolutely probably never want to set foot in a mine again, and will have to look at some other form of work or compensation.
Indeed, one completely understandable, won't it? Dr. Jennifer Wild, thank you very much indeed for joining us this morning.